Admit. Good morning, everybody. It looks like everybody's in the room, which is great. Um, just so I know people can hear me, can you just put your hand up just so you can hear and see me? Yep, lovely. There's still a few more people coming in, so hi, Viv. Uh, yeah, we'll just wait a couple of minutes because I'm sure there'll be some stragglers, which is fine. I'll just get my presentation. Okay, and the session is going to be recorded. So if you don't want to be in the recording, then just tap your camera off. If you do want to be in the recording, then keep it on. Right. Okay. Okay, I think we'll probably make a start just because I value everybody's time and I want to try and keep to time as best as possible. Um, the session this morning is due to be about an hour, might be slightly less, depends how we get on. There aren't there isn't a kind of scheduled Q&A. I think the best way to if you have questions, I think if you put them in the chat, and then if you put your email, then Claire, who's on the call, will be able to just take those details down and then we'll get back to you. That's probably the best way to make use of the time. So that the way that the session is run, it's is that it's pretty much me um, blasting as much information at you guys as possible relating to dementia care practice, and things you could be do to improve that your dementia care practice in your setting. The other thing I just want to mention is I'm sure this would have gone out to some of the people who are supporting people living at home, but this is mostly focused at care homes. So if you are a home care provider, then it might not be totally relevant. Some of it will be relevant, but not all of it, specifically the environmental areas. Um, so let's crack on. So my name's Sam Donnelly Smith. I run an organisation called NaDCAS, which is the National Dementia Care Accreditation Scheme. The the rationale really for setting up NaDCAS was that there are over 70% of people now living with dementia who are moving into care homes, and they're probably 2 years ago, myself and a group of practitioners got together and started working with numerous organisations at putting together a framework to let providers know what good dementia care practice looks like. And then there's an accreditation scheme wrapped around that framework that we deliver over a 6-month period. The the purpose of this webinar and this information that I'm going to be talking you through today is really to be giving you as providers some information and ideally some tips to actually improve and strengthen your dementia care practice now. One of the things that people often talk to me about when I'm visiting homes is what can we be doing? Um, it's great having frameworks and it's great having best practice guides, but often providers just want to know what they can be doing now that is relatively cost effective, and is relatively easy to implement. And I want to talk you through as much as I can, so that is going to help you improve your practice in your setting. I would expect that some of you guys will might already be going through the accreditation process, or might have already gone through the accreditation process. So some of this information might not be new, but what I'd love you to be doing, because it is excuse me, it is Dementia Action Week this week, which is one of the reasons why we're delivering this webinar, is that you can take away, let's say three things. So let's say three things you can take away from today and you can implement within your setting, to make a difference either to your team or to the people that you're supporting or to your environment. At the end of the day, you're all on here for one reason, which is the same reason that I work in this space, and it's all about improving and supporting people's lived experience. So that's what I want to be delivering to you today within this session, is some value about what can you actually be doing, what changes can you make to improve people's lives. So I'll just give a very short overview of the things that you could be taking away today. And then I want to talk through, within our framework, we have 9 foundations of dementia care practice. And I want to talk through each of those 9. Whilst we have 140 standards that we assess a home on when we're visiting a provider, what I want to be talking about today is some practical things that you can be changing, that relate to those particular foundations. So I'll talk through all those different those 9 foundations, and then I want to explain in just a few words at the end of the process what you can be doing today, and also I've got kind of top 5 things that we found during our assessments when we're working with providers, things that are often missed but can be easily remedied or easily explored. So please take the information as take notes. We can send you the recordings, or send any of your colleagues the recording if you wish. As I say, if anybody has any questions, or they want a copy of the recording, and or the slides, the slides are mostly pictorial, by the way. There's not massive amount of detail in the slides, which is just the way I tend to present. But if you want any of that information, or if you've got any questions, just put your email in the chat and we can send you that after the session today. So for Dementia Action Week, hopefully everybody that's on the call, perhaps this is even part of your Dementia Action Week pledge, is to jump on webinars like this and jump on things that can be actually implementing change for you and your residents. Okay, so quick swig of coffee. It's always really strange, these kind of these kind of online events, because there's no feedback, but hopefully everybody can hear me all right, and everybody's doing okay this morning, even though it's windy, rainy, and horrible outside. I want to take you through each of these areas. So there's 9 areas that I want to take you through, and the rationale behind these foundations of dementia care is pretty much looking at various key frameworks that have already been written, things like the National Dementia Strategy, VIPS framework, Kitwood's Enrich model, and research from lots of different universities like Bradford and Worcester and Stirling, UCL, York St John's, Exeter University, loads and loads of different universities that put out fantastic research, and a really great evidence base, that have helped us form these areas of these foundations of practice. So what I want to be doing within each of these sections is just outlining some areas that we'll commonly see where areas that whilst we're assessing a home or assessing a provider, these are areas that we often recommend them to be exploring after we've done that benchmarking exercise when we do initial assessment for the dementia care accreditation. So the first um, the first foundation is knowledge and understanding of dementia care. Now, one of the things that I want to break down is that there is, and I believe quite strongly that there is a big difference between dementia, the disease, and dementia care. So dementia care being how we support people living with dementia and a range of different dementias, and the knowledge, our knowledge of dementia, yes, the conditions, but also how do we support people living with different dementias. And so the essence of this foundation is around understanding how dementia affects people differently. And the most commonly taught kind of theoretical model, if you like, is what's called the enriched model of dementia care, which comes from Tom Kitwood. It looks at how people are supported and how people are understood in terms of their personality, in terms of their biography, so life history and life information being really, really valuable, someone's physical health, someone's neurological impairment, and someone's social psychology. And this is something that you could quite easily spend a whole day breaking apart and analyzing um, and exploring with your teams. But if you can do anything relating to understanding dementia care and the enriched model of dementia care, look at Kitwood's model, buy his books, and also buy. Hang on, I've got a collection of books here that I want to show you. I don't know if this will come out in the camera. Person-centered uh, dementia care, written by Dawn Brooker, um, who worked with Tom Kitwood. That outlines a fantastic framework called the VIPS framework, which again is a very easy to understand and easy to interpret model of understanding what good dementia care looks like for people. And essentially it's an expansion of the enriched model of dementia care, and it focuses on a more holistic model of understanding dementia care, particularly within a culture of care. So please buy this book. I'm not on commission for any of these books I'm going to show you today, but if you haven't got it, then definitely get one of those. So understanding how dementia affects each person differently, and this is something hopefully that you can encourage your teams to understand. Um, that dementia, yes, it's an umbrella term, and yes, it affects people differently, but how it affects people differently is very, very important. Um, we'll go a little bit further down the line. We'll go on the emotional impact and how to understand things like distress in people living with dementia a little bit later on in this session. But the core framework and the core knowledge base for knowledge and understanding of dementia care should be around that enriched model of dementia care that was put together by Tom Kitwood. The other the other thing that there's two other things actually within this section that I want to focus on. One is what we call understanding a person's lived experience. Now, again, this is something that you could probably go on a whole training day on, but we all have a different experience of the environment that we live in, and we all have a different experience of the life that we are living, and people's interpretation of our life via their own lens. One of the things that I see quite a lot when supporting people living with dementia in care homes, and again, this is relevant for care at home as well, is understanding a person's lived experience, particularly with regards to what they might be saying and what they might be doing with their body. Or someone's just coming in. I'm just having to admit somebody, sorry. Um, and the understanding of their their lived reality and their lived experience is a really key skill that teams should learn, and they can learn. It's not it's something that is teachable, is understanding how to connect with people's lived experience. Personally, I think that the easiest way to do that is through non-verbal skills. So particularly connecting with people with eyes and with touch. But one of the other key skills and key things hopefully to take away today, again, I'll talk about it a bit more later, is if you can spend the time observing people in their own environment, in the home environment, then you can begin to understand and interpret how they're feeling. And you can do this a range of ways. There's lots of different tools you can do qualitative observations within your settings, but it helps you and your teams to reflect on how people are being communicated, how teams are using their verbal and non-verbal communication skills, and essentially how people are understanding the world that's around them. And if you can interpret that, and if your teams can interpret that, then they can understand and interpret how to support them in that moment. So key areas in this section is learn about the enriched model of dementia care. If you don't know about it, just do a search or buy Kitwood's book or Brooker's book. Get an understanding of a person's lived experience. There is good training out there on lived experience training, so look that up. And then think about how your team are using their verbal and non-verbal communication skills when they're interacting and engaging with people. Okay, there we go. Okay, the next one is knowing the person, and this does obviously relates a little bit to knowledge and understanding of dementia care. But one of the things I think, if you take the dementia element away from that enriched model, the essentials of understanding individuals are knowing them as people. And this can often get lost in the daily grind of delivering care for people. But knowing the person is so critical. Um, and it seems so simple, but it's surprisingly tough for um for providers and for teams to understand an individual prior to them moving in. So this is particularly around understanding life story and someone's preferences and interests. Pers my personal interest in this area as an occupational therapist is particularly around understanding how someone interacts socially, and how they are independent in doing things for themselves. And that can be around meaningful activity. It can be around engaging in uh, purposeful activity around the home. But understanding, particularly when people are moving in, understanding someone's independent levels of independence is really, really critical, at how to plan their care essentially. The there's a couple of things that are useful, and I'm really pleased to see that, and again, no no connection with them as an organization, but I was really pleased to see in one provider, visiting one provider, that the Nourish care planning system, they now have goal setting within their care planning, which I thought was fantastic. It's something new that they're putting in, So watch this space, I imagine, for other care planning systems thinking about goal setting, is that if you're understanding people's independence, their social functioning, and obviously their cognitive functioning, then you're going to be you're inherently then going to be planning for how you're going to be maintaining their independence. And this can be around really, really simple things like, up, wash, dressed. It can be around meaningful activities of daily living around the household, but it can also be about supporting that person to live a meaningful day and plan. Let's say, goal setting for it might be their physical health, might be their mental health, might be around challenges they might face, but really things that they want the people want to be doing when they're moving in. So look out for goal setting. If you don't have it on your care planning already, then this might be something that is going to be coming. Like I say, I'm really pleased to see that the Nourish care planning system we're using goal setting. And essentially, if you're trying to get a sense early on about the individual, about their wishes, about their cognitive abilities, then you can start planning for what they can be doing, and how they can be living a meaningful day. Now, don't get me wrong, this can be really, really tricky. And there might be some of you on the call today screaming at me saying, this is really, really hard when somebody's moving straight in from hospital to a care home. And I really acknowledge that. I know when I've worked with providers who have a good proportion of their residents or the people they're supporting are moving in from hospitals, then they don't necessarily have lots of information about that individual when they're moving into the care home. But what I would advise is that when somebody's moving in, then you're assessing around the physical, but also the psychosocial and the cognitive, and like I say, about around the ability for somebody to engage in meaningful activities of daily living. As an occupational therapist, I'm always kind of trying to drive that with providers, and be that they should be thinking about how someone, if they wish to, can be making their own hot drink, or be supported to make their own hot drink, be supported to maybe make snacks, meals, those kind of things. Um, and so it's not just an understanding culturally of the care being we just provide things to the people here. It's more about encouraging people to participate. I'll talk a little bit about that in a couple of minutes. So information about the person is very critical. So when someone's moving in, thinking about assessing and understanding their social functioning, their cognitive functioning, again, something that's not commonly done. There are tools that can help with that, specifically around social and occupational functioning. The probably the most obvious ones are the pool activity level, and then NaDCAS. We have a free tool that some providers use called the PEPA, which is a personal engagement planner for purposeful activity. So that helps providers plan person-centered and person-led activities, a meaningful occupation for people. The other area, particularly around information about the person, the other area that I just want to focus on briefly is particularly for people who have a more complex dementia and/or complex background history, and perhaps even a mixed diagnosis of dementia, maybe mental health, maybe some physical challenges as well. Is that often we see providers work really well with what's called a traffic light support plan. Sounds a little bit strange. Traffic light, how does that relate to dementia care? but it can be very helpful for people who are experiencing distress on a regular basis. There's numerous tools that can help you understand distress. Uh, but if somebody is if you've already looked at lots of psychosocial interventions for people living with distress, a traffic light support plan can be something that can be really, really helpful for teams, particularly for care teams who might not understand what they should be doing at certain points and what triggers there might be, what um, support mechanisms they can put in place to prevent people from becoming distressed in the first place. So definitely look into that. How are we doing for time? 8:56. Okay. Okay, I've mentioned a little bit about this already. Person-led participation engagement. I want to focus briefly on the terminology here. Now, I don't know if many people have read some of the language that's coming out of the new CQC information on dementia care, and some of the recommendations and standards that they're going to be I imagine they're going to be putting out when they release their dementia strategy, whenever that may be. I don't know, but I know that they have worked a lot with a colleague and friend, David Wilson Wynn, who's promoting very much, among others, this concept of person-led dementia care. This being quite different, or this being, uh, how could you put it, a a a a way of understanding how to support people living with dementia, more focused with a kind of background of human rights and enablement. So I've put person-led participation and engagement because it does reframe how we think about some of these areas. Person-led meaning it is the individual that is guiding us how we should be supporting them, particularly around participation and engagement. And it does it as I say, that the language that will be coming out, I imagine, over the next 12, 24 months from CQC will be more focused on the language of person-led dementia care rather than person-centered dementia care. Something that David talks about a lot. And if you want more information, I'm sure I can connect you up with him and his team about the concepts and the theoretical underpin about that. When it comes to participation engagement, I've already talked a little bit about when it comes to understanding the person. If you understand the individual and understand their background, and you understanding their interests and preferences, then it's going to help you grade and adapt your care planning to supporting that person to live a meaningful day, or even have some meaningful moments within the day that you're supporting them. The some key and easy to implement strategies around person-centered participation and engagement is really around resources, um, and how I want to break that down is that quite often we can go into a home, and I think this might be partly, to be fair to a lot of providers, COVID's fault, which was obviously, what, 6 years ago now, that often we don't see a lot of resources um, out in living spaces. So something that's a really, really simple thing that you can be doing is putting more resources out on tables. Simple as that. So that can be in the dining room when it's not being used. That can be in social spaces, living spaces. And when I say resources, the the easiest the easiest um, way to think about resources is if you know if you understand information about the person and you understand what they might want to engage with, then you can be thinking about the resources that could be put out. Quite a few providers say to me, well, what should we put out? um, and part of me wants to say, well, you can put out some magazines and some puzzles and some books and things like this. Newspapers, can be simple. But then the other part of me wants to say, well, if you find out about the individuals that are living in your setting, then you should be able to be creative and be thinking about actually what resources could be put out for those individuals. So it's not as easy to say, oh, we'll just put out a few fiddle muffs and fidget boards, which I think on that point, my personal opinion is that it is very infrequent that you'd see those kind of resources being used, and they're not particularly person-centered. Um, it's always nice to go into homes where the resources that are on tables and are near people reflect their personality, and they reflect them as individuals within their own home. So that is something that is relatively easy to change if you don't do already. If after this call you're in a home, care home, or even in somebody else's home potentially, then just have a walk around and see what's out. Have people got things near to them that they can engage with? They can fidget with. They can feel. Um, they can just participate in some shape or form. So resources really important. And again, a kind of quick win for a lot of providers that we would work with the dementia care accreditation. And then the other point I want to make in this section, person-led participation and engagement, is particularly around your team. So, and it will be, I think it's in my kind of top 5 things at the end of this session, is trying to support your team to understand. This is particular if you have a clear differentiator between care team and activities and well-being, is that it is the whole team's responsibility and the whole team's um, uh, they're part of their job to be engaging and encouraging participation of of engagement of the people that are living in the space. Quite often we'll see when we go in to a home, and part of that assessment when we're visiting a home is spending a 2 days in the home, understanding how people are being engaged, how teams are interacting, and how people are living a meaningful day. And quite often the outcomes of those qualitative observations are around the feedback that we provide managers, that uh, the care teams often, there are missed opportunities for engagement and connection, and that can be something really simple. And personally, I try not to use the terminology activities, because often the care team might be saying, oh well, activities is the activities coordinator job, or I tend to use the term engagement. That people that it is part of the everybody's responsibility, um, whether you're care team, whether you're management, whether you're the receptionist, or whether you're the odd job person that fixes the doors, that kind of thing. Everybody's responsibility within your home should be around engagement and participation. So if you're a manager and you're on this call, I would definitely encourage you to try and promote that to your teams. It can take time. It can take constant encouragement and promotion, and often takes leadership and mirroring. So you as a leader or a manager delivering this and doing this on the floor, as it were, and then people will understand that it's part of everybody's job to be engaging and participating and encouraging people to be living well. I'm just checking the time. 9:05. Okay, fine. We're probably going to have to rush through. So I can't believe I'm only on point three. Should have made this webinar 2 hours. But you've got busy days ahead of you, I'm sure. Grading and adapting, something to definitely look at when you're thinking about participation and engagement. So grading being making a task or an activity easier by kind of reducing the complexity of that task. And then adapting, which is around using different resources to make a task more manageable for somebody. So thinking about and the image on the screen here for supporting somebody with, say, a gardening activity. There's so many ways you can grade and adapt an activity such as gardening. So it's thinking about how can you potentially make something a task or an activity less complex, which is grading. And then adapting is around using different resources or potentially even changing the environment to make a task more manageable for somebody. Just a quick one on this area as well before we move on swiftly to the environment. Is be thinking about person-led participation and engagement, particularly in the context of the dining experience. So thinking about the dining experience for somebody, you can go through kind of like a dining experience checklist, and also thinking about the living experience for people. So the dining experience is obviously part of somebody's day, really, really important part of somebody's day when they're engaging with food and the social elements of eating. But also you should be thinking about the dining experience versus the living experience, so making them quite separate and thinking about the living experience in terms of how is somebody and how are the people that you're supporting engaging in meaningful activity during the day. Okay, we're going to move on to the enabling environment. Oh, I'm drying up. I'm not used to talking solid for an hour. So environmental, it's interesting actually. A lot of providers will quite quickly move straight onto the environment, and there are many things that you can do within your environment to support people living with dementia. Um, I think the way that we look at it, the way that we assess a home when we're visiting a home is we will look at a home very individually. So there isn't really, and this is probably a critique of some of the research that does come out, is that it's one size fits all. And I would always advise that, particularly environmentally, there isn't a one size fits all with how to choose how your environment should look and how it should feel. They're all very different. Obviously, you've got homes that are brand new, that have been designed, or been, lots of things being considered around how people are engaging with the space. But we work with a lot of homes that are not new, they're older buildings, they're converted houses, there might be old kind of vicarages with lots of extensions and all that kind of thing. And the way that we look at the environment for each of the homes that we uh, work with on the dementia care accreditation is how are people using the space to support their own lived experience. And we do that by something I've mentioned already, something that I would always be encouraging providers to be doing, which is qualitative observation. That's understanding how people are experiencing and participating in their environment. But essentially, I guess one of the things to consider in your own environment is if you have the opportunities, do you have different spaces to give people different opportunities to engage. So do you have a space that might be busy? And do you have a space that might be calmer? Um, do you have a space that can be supporting people to engage in activities? Lots of providers do have those spaces, and perhaps there's some spaces that are underused. Lots of providers don't have those opportunities, so they have to think a little bit creatively about maybe how spaces are broken up, maybe using things to separate a room so that they've almost got a space for well-being and engagement and activities, and then a space for dining and living. One thing I definitely advise is think about what's on your walls, and quite often we will see quite generic pictures on people's walls. So and generic kind of bits of, I don't know what to call them, kind of like vases and things like that, things that aren't can help with the decor but aren't particularly homely. One thing that is, it does seem to help with some people, particularly around engagement and participation, is thinking about the things that are on your walls and how can you use what's on your walls to support people to orientate themselves, so to know where they are. And you can do this with, putting things on the walls, nice big lovely beautiful pictures on the walls of the local area, things that might help somebody recognize the area that they're in. Also, something we see that's really, really lovely. I was in a home a couple of weeks ago, and there was this beautiful picture of all the team, and it wasn't like a staff board. It was just all the team and them supporting the people. The pictures of people engaging in activities and well-being activities, and it makes it feel so much more homely than when you just see generic pictures of, I don't know, a landscape or, like I say, just a standard vase or something like that. And it's definitely something that I would always advise, particularly for new builds, is thinking about what, if you're trying to develop a space for people living with dementia in your community, then be really thinking about what's on your walls. So again, today, if you're a manager of a home, um, walk through your home, look to see what's on the walls, think about, does this, if I didn't know where I was, would this help me understand a little bit better where I was? Um, or would it help me communicate or engage with other people in this space? So thinking about what's on your walls is really, really, really important. Um, there's bucket loads of things I could talk about environmentally. One of the other things that is another kind of quick win, if you like, for providers. I don't know where my phone is, but you can. One of the things that is fantastic research that has come out of University of Stirling is around light and dementia care, and particularly light and how people can engage with a space better if the light has improved. So you can actually, on your phones, I've got it, I'm always using it. You can download, I think you can get it on Android and on Apple. You can download an app called Lux, and it's a free to use app, and it's a light meter, and it helps you understand how what light there is in a particular space. And if you can, the golden number, there's lots of different numbers if you really want to get into the weeds with it, but the golden number is 150 lux. If you can get a social space, a living space to 150 lux, and bedrooms as well, then you're kind of sitting around the right zone in terms of light. And one of the things that is fantastic when providers do consider light and do adapt light, that's natural light and unnatural light, is the impact it has on the team, but also the impact it has on people's alertness and engagement levels. So light is something that you can change quite quickly, and it has a really big impact on people living and working in your space. Making sure that people use the outside as much as possible is really, really important. There's a big movement called Open the Doors, um, which is an international movement which is around supporting people living with dementia who live in care homes to access the outside. So if it's something that is difficult for you for various reasons, then it might be worth reaching out to us, and we can put you in the right direction, and support you to try and encourage people to be accessing the outside more. Um, so that's really important. And the other one, just quickly, because I'm only halfway through, um, or just past halfway through, is a concept called landmarking. So some people will navigate their space through color. Some people will navigate through signage. It doesn't mean you have to put, you know, big, bright, clinical, hospital-like signage everywhere. There are nicer kind of signage options out there. Um, but you can people can navigate through signage. They can navigate through color, and they can also navigate through landmarking. And this means putting things in places that allows people to recognize where they are in the space. Um, if I had time, I'd probably tell you a story of when I got lost once in a city and my phone died. And the only way I could find my way back to the hotel I was staying at was remembering landmarks that I'd walked past, things like churches or strange looking trees, things like that. And you can do that within your own space. So if you want people to recognize or to recall or to orientate themselves to a living space, a dining space, um, then you can place a landmark near that space that will allow people to recognize them. That can be something as simple as a plant. It can be something as simple as an interesting picture on the wall, or a table in the hallway with some items on. It just helps people to recognize where they are in space. Okay, homely environment. I'll just touch on this really briefly because there's lots of other things I want to talk through. Um, I think the key message here um, is that you should be thinking of your space as a home, and reducing as much as possible the clinical impact. Now, I appreciate that with some homes, or with say some homes, with a lot of homes, there can be um, it can be necessary to be more clinical than others. But when a provider can change their decor, their furnishings, um, and their what's on the walls to make it more homely, then people will have a better, more relaxed experience of the care that you're providing. The Some homes we can go into, and it's quite, you get quite a clinical feel. There's not much on the walls. There's a lot of kind of wipe clean surfaces, and again, I think COVID has a lot lot to answer for with a lot of this. But trying to think about creating a more homely environment, and even if you can, depending on the size of your community, of course, is thinking about the people that are living in your space. How can you make it more like their home? Um, you know, could be pictures. I've been into homes where people will have their own pictures in their living spaces, which is lovely to see. Can be, often can be copies of pictures if people are, precious about things getting lost or moved. Uh, but using plants and greenery, um, I think the general understanding around uh, uh, patterns is that it should be something that should be considered for people with certain types of dementia. But if they do experience um, confusion and distress around patterns, rather than no patterns in the house or no patterns in the home, that it should be considered as an option environmentally. But actually, within people's own homes, then you're quite likely to see certain patterns on things like curtains and cushions and things like that. I think that personally, I think that probably the when it comes to patterns, I think the most times that I've seen instance of people becoming confused or distressed by patterns, it's been on the flooring. So if there's geometric or highly patterned flooring, um, then I've seen quite a few instances of people being confused or impacted by those patterns. So again, it's a word that we would use a lot with providers. Is that these things should be considered for people. There isn't, and there shouldn't be a blanket rule that such and such is suitable or not suitable for people living with dementia, because as we learned right at the start, everybody is experiencing dementia differently. Um, because of that, our understanding of that enriched model of dementia care. So make your care home more homely as much as you can. Um, I'm getting very short on time, so I'm going to whisk through some of these areas: light, sound, smell, and touch for well-being. Um, Light, I've already talked about. So get a light meter on your phone. It's totally free. 150 lux. The other area is around air quality, so that might be something to consider. And then also hearing, people's hearing loss. So there's quite a few providers now looking into um, certain technology, certain loop systems to support people's hearing. Um, there is pretty clear evidence around uh, people's hearing deteriorating and their memory and or the dementia progressing further. And obviously, um, uh, uh, one of the things that can impact people earlier on in their dementia journey is mid-age hearing loss. So considering people's hearing is important, and there's some great technology out there that can support you with that. Team induction and nurture. So what I want to do, I think, because I'm conscious of time and I'm very precious of um, your time because I appreciate you being here, is I want to whisk through some things that will be very helpful for you in terms of induction and nurture, and then also around vision, culture, and leadership. So I'm just gonna whisk off um, these some pointers and some practical steps that will help you. Um, okay, if you haven't already, then there's some great stuff on YouTube around training, nurture, and understanding distress, people living with dementia. So YouTube, Ian James, Naomi Fell. I'm sure a lot of people will have heard. David Sheard's got some great stuff on there as well on YouTube. When you're training, we would always look at a provider when we're understanding training and inductions, is that e-learning is not sufficient. E-learning is an inevitable part of a person's induction, but to support people living with dementia well, then a provider needs to go beyond e-learning and look more into face-to-face training on understanding distress, understanding people's lived experience, and particularly psychosocial interventions, and people's emotional and social competencies. So I think there is some great training out there. I think the other point on training that I just want to make quickly, if you're a provider thinking about training, then think about training, but think about the sustainability and the ongoing implementation of that training. So, and I've got a great book. Again, I don't know if you can see it, but it's called Education and Training in Dementia Care, and it's by Professor Claire Sir, who's at Leeds Beckett, Sarah Jane Smith, and Isabel Latham, and it breaks down some really interesting points around what good dementia care training looks like. It's a great read if you're interested. Um, and the sustainability element is something that really stood out for me, in that it's not one, e-learning's not enough. Two, if dementia care training is implemented and delivered, then it needs to be there needs to be an element of reflective practice and sustainability after that training has happened, rather than it just being training in isolation. So that's a great book to look into education and training in dementia care. There's lots of great stuff out there around language, development of language for teams. So again, if it's something that you're interested in, just get in touch with us and we can send you some information. I want to get to the last five things, because the session's going to end at 9:30. Team approach and emotional connection. This the most common area I think that we see that requires development with teams is when we see what's called overpacing. So really, teams needing to slow down their communication skills when they're approaching and connecting with people. And then again, some really quick, easy wins that you can get a better understanding when you're using qualitative observations is eye contact, touch, and gaining someone's awareness and gaining their attention before communicating with them. So they're really, really simple things that we see quite often, teams, because there's lots to do during the day. There's lots of support tasks that need to be delivered, that often we don't see teams just getting someone's attention and connecting with them before they're communicating. So connect before communicate is a kind of mantra that I would always be trying to support homes to promote to their teams. But yeah, overpacing is probably the most commonly seen challenge that we would raise with teams, particularly around when they're trying to support people to, say, move from one room to the next, or go into the dining space, or even the dining experience itself is overpacing. So that's something to look out for when you're considering the care that you're delivering. Okay, and then the last one, we're probably going to go over a couple of minutes. Hopefully that's all right. If you've got to go, you've got to go. The last one is vision, culture, and leadership. So there's a couple of points that I'd just like to make on this area, which is look into what you can read on dementia care. Look into the Journal of Dementia Care, because there's always great resources within that journal, and lots of great projects and great research around best practice in dementia care. And I had the privilege, just talking about culture briefly, I had the privilege last week, I think it was, to go to Belong Dementia Care Villages, and they've got this fantastic concept, which is really building a community and really focusing on the intergenerational aspects of care. And it was lovely to see a nurse, the particular place that I visited, they had a nursery actually within the care home, um, and seeing that embedded within the culture of the home was absolutely magical. And not every home can do that. And one of the reasons why I wanted to experience that is to then provide value to other providers that can't necessarily do that. And essentially that's around connecting with your community. So finding what's out in your community, looking to see if there are any nurseries or schools nearby that you can connect with, and go beyond um, the kids just coming in and singing Christmas carols at Christmas. If you can develop a really strong relationship with a nursery or a school, primary or secondary school, then that's going to really empower your culture. For just talking about vision is whether you're big or small, it can always be helpful. If you're a big or small provider, sorry, it can always be really helpful to have some kind of dementia strategy. Um, and that doesn't have to be a kind of war and peace document. It can be just a kind of vision and value piece on how you want to be supporting people living with dementia in your communities. And it does, even if say I've seen single homes develop a strategy, um, but particularly if you're a provider with a large number of homes, then it can be really helpful to focus your leadership team, but also focus your care teams around what your values are around supporting people living with dementia. Okay, just quickly before we go, 5 things you can change today. I've already mentioned it. Resources. So more resources out. Find out about the people you're supporting. Get more resources out in your living and your dining spaces. Um, provide, particularly if you're a manager, provide permission to your team to engage and support people. Um, qualitative observations. So if you can, get the team to observe each other. There are tools out there. Again, if you want some resources, we can send some over that are totally free. The most commonly used are the Port tool. There is dementia care mapping, but there is some training you have to go on for that one. But if you can implement qualitative observations and reflective practice, then that will help your team develop over time. Landmarking, greenery, and thinking about the outside space. And then the final one, which I haven't mentioned, but I'm glad I put it on here, is look into cognitive stimulation therapy. So this is a group therapeutic intervention for supporting people living with dementia, particularly kind of mild to moderate dementia. And there's books you can buy. There's even some technologies out there now that are delivering digital versions of CST that help your teams deliver it on smart TVs and tablets and things like that. But look into CST, which is cognitive stimulation therapy. Okay, I hope you've taken something away that's useful in all that. Again, if you want a recording or if you want a copy of the slides or if you want any information and or any of the resources that I've mentioned, then either just put your details in the chat or send me an email. I've put my details there. I'm on LinkedIn as well, but sam.ds@nadcas.org. And importantly, have a great Dementia Action Week and make some change happen. Thanks, everybody. I will see you hopefully again, and I appreciate your time. And look after yourselves and have a great Dementia Action Week. Thank you. Bye.